the head circumference above the ears. And then assessing the size of the fontanelle. There's one in the front. Just take the bow off. And then what's next?
The eyes.
Checking the eyes.
You're checking the muscle.
Checking where the eyes are looking.
Check for any swelling.
Swelling that happens at childbirth.
Yeah.
No swelling.
And then the nose, which you occlude like each nostril and just feel how they breathe.
Check their breathing. Okay. And then we didn't do the chest circumference.
Oh yeah, that's right. Oh, and for the head circumference, the normal range is 33 to 37. Yes.
And then the chest, normal range is what? Is there a normal range?
I didn't see on the video.
Okay. And then I think we also have to assess the ears, right?
Yes.
Like where the ears are.
And how fast it retracts when you push the pinna.
The pinna?
Yeah.
Okay.
And then for mouth, it's just checking how their sucking reflexes. You kind of palpate their soft and hard palate.
Yeah. And then I think she checked the range of motion, right?
Yeah, the reflexes of the baby. And the skin, because usually they have rash. Well, it's normal to have rash until the 6 weeks of age, then it starts to lighten up. And then check for their abdomen. Usually it's round. And then listen for the apical pulse for full minute. And their normal range would be 120 to 160 beats per minute.
I'll pretend I got my stethoscope.
Mm-hmm.
We also have to check respirations, right? So
yes.
It was, you can either watch the tummy up and down or put your hand on the tummy.
Yeah, for also 1 full minute.
For a full minute.
Yeah, and the normal range would be 30 to 60.
And then
the temperature.
The temp in the
axilla.
Yep, so underneath the arm. And if it's too low on one side, we try the other side.
Yes. And then usually for neonates, their normal range is 36.5 to 37.5. And then we also put them on the scale to check for their weight.
Okay, so we'll put the baby on the scale to check for the weight. There's no average weight, huh?
Yeah, no, I guess it just depends.
For the female, for a little girl, we do have to assess the genitalia, right? So
yes.
It's maybe slightly swollen and may have white discharge, which is normal.
Mm-hmm.
So you would have to look.
And also flip them to check their gluteal area. Just check for the symmetry, any redness, or...
Because if it's off, the symmetry's off, it could be hip displacement, right?
Yes.
And then also check the spine
Mm-hmm.
to make sure that it's straight. Palpate the spine.
Yeah, palpate it. And then lastly, you auscultate the vowel sounds.
All 4 quadrants.
Mm-hmm. And that's how you assess a baby head to toe.
That's the full baby assessment.